Sure. So let's talk about this early detection, particularly important for bowel cancer, and how does it impact treatment outcomes?
So bowel cancer typically grows quite slowly, but it also doesn't tend to have specific symptoms until it's quite well developed. So not all, we have growths in the bowel sometimes called polyps. And these are those where I was saying you can get growth because the cells aren't doing what they're supposed to do. They're growing and they're continuing to multiply when actually they shouldn't. So one of the things you can get is a polyp. And that's a small growth in the wall of the bowel, in the lining of the bowel. Not all polyps will turn into cancer, but one of the things we know is that almost all cancers start as a polyp. So bowel cancer can grow quite slowly there in the bowel, and you might have no specific symptoms at all until it gets quite developed, and you might then have, visible bleeding or blockage of the bowel or something. At which stage it's really quite developed. It's a late stage cancer. The difference we see between stage A, which is the earliest, the lowest stage of cancer, versus stage D, which is the most developed, is that at the earliest stage, your chance of success, of treatment success, is 99% in 5 years' time. If it's the later stage, it's about 14%. So if you were to get a bowel cancer diagnosis, and the odds you've got there are 99 in 100 versus 14 in 100, that's a vast difference.
Yes.
And the key here is screening. As soon as those polyps start growing, something we know about polyps is that they tend to secrete small amounts of blood into the bowel, microscopic amounts of blood. So before you can see it with your eyes, it will be in there, and that's what the test is looking for. The test doesn't actually look for cancer. The test looks for microscopic amount of blood in the poo. And so if it picks that up, what that says is you need to go and have a colonoscopy and find out what the cause of the bleeding is. And in theory, you get it at an earlier stage, where if you'd waited till you had symptoms that were significant, then you might have picked it up at a much later stage. So it's the only way to look for early stage bowel cancer. And yeah, very important that you do so. It's a lot of thoughts people have are around not wanting to know or ignoring it till if I have to, I'll go and get checked, or I'd rather not know. But
Yes.
that's really the opposite. You do want to know. You do
Yeah.
want to go looking. You do want to find it now. Find it today, and hopefully get it when it's early. Or one of the great things about this is actually that because you can pick up those polyps, you might pick up something that's going to become cancerous later that hasn't become cancerous. So you may never get a diagnosis because you do the test, you find that microscopic blood, you do a colonoscopy, the doctor says, we found some polyps, we took them out, you're good to go.
Yeah.
See you in a few years.
Yeah. So this microscopic blood is not seen in the naked eye, but it can be seen in the test at a lab. So that's why it's important to do this test, which we'll talk about.
Seeing blood in the bowl or seeing blood on your underpants is a symptom, can be a symptom of bowel cancer. And again, this is the thing, it could be a symptom of other things. It could be a symptom of hemorrhoids. If you see that symptom, you need to talk to your doctor about that. The test is no longer the right thing to do there. You have an obvious symptom that needs to be investigated. The test is for people who are, again, often people will say, but I feel fine. I have no symptoms. I don't need to do the screening test. Again, in fact, it's the opposite. If the test is designed for people who feel well, who don't have symptoms, this is how you check that everything is in order. And if it's not, you catch it before it, ideally you catch it before it develops into something bad.
Yeah. So generally, from what I've also read and what you just said, bowel cancer at the early stages has no symptoms. So it's important for that testing to happen.
If it does, they're quite often they can be quite vague symptoms. They're non-specific. You wouldn't say to somebody, I have some unexplained weight loss and my tummy's a bit upset. That doesn't, point you towards that's not going to trigger thoughts about maybe I have bowel cancer. But they might be the only symptoms that really present in that early stage.
Yes.
And, in a few years' time, it could develop into something that you end up, needing to go and see about because you've got a blocked bowel. And if it's been left that long, that's a very different position to if you picked it up earlier by having done a screening test.
Yeah. Okay.